Hi, Mike Gibson, and I'm joined by my good friend and colleague, Shinya Goto. You have some beautiful cherry trees behind you, Shinya, just ending your season of blooming there in Japan.
Yes, sorry about that, but we enjoyed a lot. Thank you very much
Yeah.
for inviting me for this talk.
Well, Shinya, my son asked me, "What are you doing, Dad?" And I said, "I'm working on trials of factor 11 deficiency." And he just laughed and said, "Why do you keep doing these big trials?" The answer's already there. It's Mendelian randomization. Why don't we go look in the UK Biobank at people with factor 11 deficiency and outcomes? And 3 minutes later, he started saying, you may be onto something. People with factor 11 deficiency have lower rates of stroke and VTE. And so you did a fascinating study, Shinya, you and your co-authors, looking at the relationship between outcomes and people with factor deficiencies. Talk to us a little bit about what you did and what you found.
Okay, yes, right. I mean that we have published a paper entitled by antithrombotic therapy in people with hemophilia. Hemophilia is the coagulation factor deficiency, deficiency of factor 8 or deficiency of factor 9. So those are bleeding disorder, serious bleeding disorder. Previously, we cannot expect they can live long. So, they don't have a problem with atherothrombosis, or, they don't have a problem with atrial fibrillation and stroke. But now the hemophilia treatment become impressively improved. So the longevity of the people with hemophilia A and hemophilia B become much longer as compared to previous. Now those people become old enough to get atherosclerosis, and those people experience myocardial infarction. Obviously, it's a thrombotic problem. So if the patient with hemophilia, they are taking factor uh, 8 or 9 for bleeding treatment, come to your cath lab as acute coronary syndrome, you know, are you brave enough to use antiplatelet agent for these patients? I think it's a very good question, and we cardiologists didn't touch so far. We don't have a good quality of data. I mean that we don't know how much hemophilia people with acute coronary syndrome received aspirin, dual antiplatelet therapy. If the patient become atrial fibrillation, can we use anti-10A? They already deficient with factor 8 or 9. Is it feasible for us to add anti-10A? You know, we need to have a data. So, I learned a lot from my co-author, Dr. Nagao. She's an expert in hemophilia specialist, and we need to, develop a good quality of data in this field for the future. That's why I ask you to have a kind of interview with you. I'm a fan of your interview, so I always hear, a lot of your interview. So I really want to join and discuss this problem with you.
So, Shinya, there's obviously no randomized trial data. Is there any observational data looking at bleeding risk with dual antiplatelet therapy or factor 10 inhibition on top of hemophilia?
In regard to the quality of cardiology quality, no. They try to accumulate the data. My friend, Dr. Adasa Nagao, accumulated 600 hemophilia patients, age more than 40, and she followed up 10 years. So that's a kind of biggest data on the globe. So, we need to have, for example, if we collaborate with her. We would recommend her to start accumulating the people with age more than 60, something like that. Age 40 is not enough to have the outcome data. We know, there is a case report, showing dual antiplatelet therapy is correlated with ACS in hemophilia A and hemophilia B, but those are just case report. So we really want to have a kind of registry data that is
Yeah,
deficient right now.
yes. Well, that sounds like the next step. Love to work with you. I'm sure many people out there would love to work with you. We get a lot of hematologists together, cardio
Yes,
hematologists together
yes, yes,
to
yes.
create an international registry of this.
Yes,
That sounds like a
yes,
really good idea.
yes,
So
yes.
let's all put our heads together. Well, Shinya, that was fascinating. Thanks for telling us about your manuscript, the challenges, and how we might be able to meet them. Thanks for joining us today. Love Japan, love all the people in Japan, and thank you for being with us. And thanks to all of you for joining us today.
Thank you very much. Looking forward to collaborate to
Thank you.
develop a new data.
Thank you, Shinya.